Alexander Kegg. I'm a licensed clinical social worker in the state of Florida, and I'm also the co-founder of the LGBTQ Caregivers Center. Sometime around mid-2017, I was having brunch with my father, and I was just engaging him in some casual conversation about, hey, Dad, how's your week been? And he made some comment that just stuck out as kind of strange to me. Even though I'm a social worker, I had never worked in gerontological social work, right, or geriatric psychiatry, none of those locations. So I didn't really know too much about dementia. I didn't understand what was really happening. My father is a veteran. He served in the U.S. Marine Corps, and I thought, I'm going to get him enrolled in the local VA, and I'm going to take him in there, and he needs to get assessed. And so the first appointment he had, it was about 3 weeks later, and they did the mini mental examination, and he did very poorly on that examination. And it was at the end of that assessment, she sat me down and said, your father can't be home alone anymore. And so we then were able to, through the VA, arrange for him to go to adult daycare. But once COVID hit, the adult daycare program closed down. Well, so did the VA clinic. Everything closed down. My workplace closed down. My wife's workplace practically closed down. I'm a member of the LGBT community. I was looking online for resources around caregivers. I found a lot of resources around LGBT elders and aging, but I didn't find anything for caregivers. And so in early 2021, I teamed up with another social worker, and we co-founded the LGBTQ Caregiver Center, which is a virtual hub where people can go for resources and learn about research, and also access our wellness offerings, everything from meditation to breathing exercises to qigong, heart math, all kinds of really wonderful resources for the caregiver community. So I live in Orlando, Florida, and there is an organization here that's specifically for people with and caregivers of people with dementia and Alzheimer's. And so when I was looking on their website a few months back about their caregiver resources, I noticed that one of the groups that they have, one of the discussion or support groups that they offered, it said men only. So I was really happy to be able to find a caregiver support group, especially one that was for men, because it's just a different kind of story. It's a different, especially when you think about how there's not a lot of socialization around being a caregiver. My experience with the VA has been fantastic around my father. I'm also a veteran, and I've been using the VA since 1988, and I have hardly any complaints over all those years.
Compassus is celebrating your 15-year anniversary since you founded the company in 2006. Can you share a little bit about your history and give us an overview about where you are today?
In fact, although we're a 15-year-old company, we've got many of our locations that are much older than the 15 years. And so, for instance, we have a hospice program in Springfield, Missouri that's actually over 42 years old. We started out as a hospice company in 2006. And over the last 15 years, we've evolved to what I'd like to say and think of as a post-acute care services company. So we provide, in addition to hospice, historically what we've provided, we also provide home health, palliative care, and home infusion. And we have evolved over the last several years from providing care directly to patients and to their providers, which we still do, but we've evolved to provide care through partnerships with community-based partners. So today we have over 200 programs in 30 states. As part of that, we have a preferred provider relationship with Ascension, and it's their intention for us to work with them to provide and evolve their post-acute care services across their 140 hospitals or so.
I'd like to start by talking a little bit about care delivery the Compassus way and how you've really repositioned to a model platform that amplifies personalized care consistently and methodically across 200 locations in a standard, high-quality way.
Well, that's great. Well, I'm delighted that you want to talk about this because it's something we're so excited about across our organization. We were awarded by NQF a Next Generation Innovator Award in 2020. I expect that by 2023, we will have delivered this kind of care delivery the Compassus way to over 150,000 people. It's in our DNA, the whole notion of delivering care to patients in a patient-centric way is what hospice is. And our model is ever evolving. We're not done. It'll never be done. But the kinds of things we're dealing with today are how do we harness technology to improve on identifying patient needs and then capturing both the things we do and most importantly the outcomes that we're creating. So harnessing technology to support that is part of our evolution. And as I said earlier, integrating our model throughout our entire organization is really critical to us. And, it's all part of what our vision includes the notion of providing post-acute care services to patients and their families at the right level of care at the right time and in the right location. But it all starts with what the patient wants and what the patient needs and what the patient's realities are.
I can't help but notice that Compassus uses a Black woman and the tagline, "Care for who I am."
Her name is Gloria, and Gloria is a real patient, was a real patient with us. In any of our materials and the like, they're not models, they are real people.
It is also really striking and in looking at this, really very effective in telling a story about caring for who people are. What have you learned about health equity in this process, and how have you seen health equity in developing out these service lines and evolving to where you are today?
So the company culture focusing on patients means all patients. We care for patients, we care for their family, we care for others on their care team, whether it be other relatives or whether it be their primary care physicians or other professionals involved in their care. And, over the last 10 years, hospice penetration, hospice utilization in America has almost doubled. And we've led that. Reaching underserved communities is a very large part of what we do and have done. We are a national company, being in 30 states. We are in rural America. We serve Native American communities. We serve inner cities. So we're in all areas of America. And, we've thought for a long time that there's certain segments of the minority populations in America that utilize hospice at a lower rate than the majority populations or than other populations. We've always tried to understand why that is, and we've tried to be sure that the mix of our staff and our messaging and our communications are consistent with what those populations would be comfortable with. It's all about developing trust in a population of people. They've got to believe in our sincerity. They've got to believe in that what we say we do, we really do. They have to believe that we are doing what we say we do for their benefit, not for our benefit. So we're real excited by the strides that we've made, and quite frankly, that the industry seems to be making, both in home care and hospice, but also palliative care and infusion.
Your Compassus commitments are aligned very well with C-TAC's 2021 core principles for serious illness.
Compassus is committed to expanding care delivery the Compassus way, as we've been discussing. You know, our care model to include disease-specific pathways through training of our over 7,000 colleagues and reaching more than, as I said earlier, over 150,000 patients and their families in 30 states by 2023. Compassus is committed to caring for our patients as the unique people they are by leveraging our award-winning and innovative care delivery model. We amplify our complete commitment to personalized care consistently and methodically across all of our services. Our care delivery the Compassus way has the added benefit of providing our payer partners the demonstrated returns that they need to bring value-based care to their covered members. Compassus is dedicated to meeting the growing consumer demand for care at home, including improved access for underserved communities. And finally, it's our full continuum of care options: hospice, home health, advanced care management, and palliative care, together with partners, providers, payers, and community resources, will make overall care more accessible, safe, and affordable. That's the next evolution of post-acute care, is not just a conglomeration of services, but a single set of services that are connected and allow for a smooth transition from one level of care to another level of care.
Thank you so much for your leadership in this space and to your commitment, continuous commitment to standardizing care and delivering high quality team-based care that we at C-TAC can be proud of.
My name is Rhonda Ford Chapman. I'm the Vice President for Health Strategies for the American Heart Association here in the Greater Maryland region. Thank you for inviting us back this year to talk about the Bristol Myers Squibb Foundation and the work we were able to complete during a very challenging time. I have with me today two of my wonderful volunteers, Dr. Athol Morgan and Anoop Raman. We're going to talk about our specialty care project and the fantastic results we're seeing already with providing this really high level of care to patients. Dr. Morgan, tell us about your work.
I am a cardiologist practicing in West Baltimore, where I have been for a number of years, and I'm a longtime volunteer, Rhonda, as you know, for the American Heart Association, and currently sit on the board of the Greater Maryland AHA, which is a privilege and a pleasure. I have been working with Absolute Care since their inception. They take care of a very high-risk, difficult population of patients here in inner city West Baltimore. And I have been one of the cardiologists taking care of their patients. I have always been curious to see if it would be advantageous if the specialists could work more closely with the primary care team at Absolute Care. They have a very high level of wraparound services and teams assigned to patients that include not just the primary care provider, but all the ancillary services of social work and pharmacy and all these things. And I've always wondered if closer integration with the specialists would be good. The integration with the providers, the more ready communication, because we have providers right on site. And so I am quickly able to talk to them. They sometimes will stick their head in when I'm there, and they might have a quick question, and we're able to resolve it much more quickly, much more effectively than previously. I've also been able to reach the other members of their team, the social workers, the pharmacy.
What a great lead into absolute care and Anoop. He's absolutely the way to go. I really find it very great that Absolute Care is taking such a 360 approach to the patient. Can you tell us a little bit more about your model?
In terms of our model of care, so we essentially take care of the sickest 4 to 6% of folks on public insurance, mainly Medicaid. And our model is essentially concierge care for the sickest instead of the richest. So what that means is essentially providing top-notch service for the folks who typically fall through our fragmented healthcare system, right? And so what our members first notice is we knock down transportation as a barrier to care. So we bring all of our members to our centers via either our own van service or by Uber or Lyft. The other piece that they quickly notice is that it's very high touch care. So our panel size is a typical primary care provider in America has 1,500 to 2,500 patients on a panel. We have 20% of that. So it's 300 to 400 patients per PCP. In addition, it's not just a primary care provider and a medical assistant taking care of our patients. We know that they need more intense services. And so it's for every PCP has 2 MAs, 2 nurse care managers, and a social worker wrapping around services. In addition to that, for every 2 PCPs, we also have a community health worker, a transitional care nurse, as well as a behavioral health consultant. Because we know when we look at high cost, high needs populations, it's physical health, but it's also behavioral health and also social determinants of health that really determine the ultimate outcomes. And then in addition to the high touch care, like Dr. Morgan was mentioning, we really try to be a one-stop shop for our members. So our model has always included labs and x-ray on site. One critical component of our model that had been missing prior to this collaboration was subspecialty care. Right? So we know that we've known that as much as we try to be a one-stop shop, people do need to see their cardiologist once in a while. And so in order for us to really strengthen that collaboration, being able to bring cardiology on site so that when our members, for example, with congestive heart failure or atrial fibrillation need services, they can come in, they can see their PCP, they can see their cardiologist, they can get their medications, just like Dr. Morgan was mentioning. In addition to that, when they're not on site, we can also curbside Dr. Morgan and benefit from his expertise informally. And so he's both benefiting the care for people who have scheduled appointments with him, and also our entire panel of patients who benefit from that expertise.
Wow, that's pretty impressive. Thank you so much. In Maryland this year, we passed telehealth, and I just see this as another step of being able to open up access to patients for the highest level of care possible. This project was really designed to identify those pain points for the patient and help move them along their journey to specialty care, because we know they'll have a better recovery if we can do that. So thank you both so much for everything you've done to support the project. We want to thank again Bristol-Myers Squibb Foundation for their fantastic support of the American Heart Association over the years. And we wanted to remind everybody that the scientific sessions for the American Heart Association will be taking place November the 13th through the 15th, and it is also virtual. So we do encourage everyone to go to our website and check out all the newest and latest science that will be produced.
I'm just glad that we've moved beyond the pilot, so that it's embedded in our model of care. And we're just thinking of more ways that we've learned from this model and how to adapt it to different specialties within Baltimore. Just very grateful for kickstarting the collaboration and really looking forward to where this goes next.
I just want to relay some of the feedback that I have gotten from some of the patients about just how much easier it is for them to be able to come and see me as a cardiologist and to get all the things that they always had to get, but but had a harder time getting done. In particular, managing medications. In the past, it was sometimes difficult to get a clear idea of exactly what a patient is taking. It's much trickier than any of us might realize to just find out when you have a patient right in front of you what they're taking. But if you have ready access to their pharmacist, if you have ready access to their primary care provider right there on site, those kinds of issues do get resolved much more easily. And you have access to things like the pharmacy aids that Absolute Care provides. It's just been really terrific working with the system.
With that challenging and rewarding roundtable and spotlight videos, we're going to now transition to a period of time that we hope will allow you the chance to engage with our sponsors, connect with other individuals who are also in attendance, and to take a well-deserved break. We'll be back with you at 4 p.m. Eastern Time to address the intersection of advanced care planning, policy, and practice. I'm Dr. Tamron Gray, and I look forward to seeing you then.